Matrix. By the way, I watched 2 of those yesterday. 2 of the Matrix movies. All right, what I want you to be able to tell me is what specific effects does the sympathetic have on these particular effectors, and what effect does the parasympathetic have on these particular effectors. What I'd like you to do, and I'll give you some time to do it now, is think about what would happen or what your body would need to be able to do in a fight or flight situation. And that's, to me, I've found that that's been the best way for students to think about these. Instead of just memorizing it, think about the situation. What would your body have to do to help you survive in a fight or flight situation? All right, as it relates to these things here. Okay. Now, all this information is in your book on 572, I believe. There's a table there. You can look it up. It doesn't matter to me. Okay, let me go over a few of these with you. I think this table in the 6th edition has been updated a little from previous versions. Maybe some new research has been conducted on sympathetic and parasympathetic, because some things in here look a little different to me, which isn't going to make a big deal difference for us. But all right, so I talked about the effect of sympathetic on the bronchioles, and that was dilation. In other words, the smooth muscle of those bronchioles relaxes, allowing those tubes to have a greater opening so more air can flow in. Parasympathetic does the opposite. Digestive glands. We don't want to be digesting things and expending energy on digestion when we're trying to save our life, either by running or staying. So this is going to decrease the activity or secretions of those digestive glands. Parasympathetic would increase. Because remember, resting and digesting is parasympathetic. Blood glucose concentration. Now, it doesn't directly say blood glucose concentration on the table, but it does talk about the liver and the breakdown of glycogen or the formation of glycogen. So what we would see with sympathetic is that we would see an increase in blood glucose concentration because the liver is going to be breaking down glycogen, which is stored glucose, all in these branched chains, remember, and it's going to release that glucose into the blood. So we would see an increase of blood glucose concentration. Parasympathetic, we'd see a decrease in blood glucose concentration because the glucose is going to be converted into glycogen and stored as glycogen. Sympathetic is going to inhibit contraction of the urinary bladder muscles. Does it say no effect? Yeah, it actually has no effect. But it does cause the contraction of the sphincter that prevents you from urinating. So even though it has no effect on bladder muscles, maybe you want to make a notation here about the sphincter, that it does cause constriction of that sphincter, specifically the internal urinary sphincter, which is under involuntary control. It's a smooth muscle structure. So that is constricted, which prevents urine from leaving the bladder. Whereas parasympathetic, urinary bladder muscles do contract under parasympathetic. That forces the urine out of the bladder. And it actually causes that internal sphincter to relax. In other words, sympathetic, we want it to inhibit urination. You don't want to have to worry about going to the bathroom when you're in a fight. Heart rate increases heart rate. Parasympathetic decreases heart rate. Intestinal muscles. Parasympathetic is going to increase or going to stimulate contraction of those intestinal muscles. It's going to increase the gastrointestinal motility, moving the food through the digestive tract. Sympathetic is going to decrease gastrointestinal motility. We don't want those to be working. We want that energy to be used for something else. And vasomotion. This is one of the things I think that has changed from previous editions. When we talk about the skeletal muscles, sympathetic, or the blood vessels in skeletal muscles that causes vasodilation. Causes those blood vessels to dilate, allowing more blood to flow to those skeletal muscles. Parasympathetic has no effect on the vasomotion of skeletal muscle blood vessels. Now the chart is kind of vague when we talk about the coronary arteries. It's kind of vague when it talks about, mentions both vasodilation and vasoconstriction with sympathetic. And that looks like something that's changed from the previous edition as well. So as far as this vasomotion here is concerned, let's just assume that for skeletal muscle blood vessels, sympathetic dilates, parasympathetic, no effect. And as far as the blood vessels to the heart, we're going to say sympathetic is going to dilate those as well, because we're going to want increased blood flow to the muscles of the heart. Heart is going to be working harder. It's going to need more blood. All right. Any questions about the table?